It's now 10 days until England is supposed to leave lockdown for good. To say it's on a knife edge is putting it mildly. It is, of course, data, not dates, that will determine when the Prime Minister will lift restrictions. And today, we got plenty of important new detail on the spread of COVID. Almost 30,000 new cases of the Delta variant have been identified in the UK in the past week alone. The evidence suggests it's far more contagious and more likely to leave you in hospital. But the vaccines are working. So let's get the details, because our health correspondent Catherine Jones is with me. And of course, the PM will be looking at all these numbers in the same way we are. Are they threatening to disrupt his plan?
Well, the roadmap, as set out, the timing of that really well matched, actually, the challenge that the Alpha variant, the Kent variant, posed. But it is, as you say, this Delta strain that now accounts for almost all infections across the UK that has really moved the goalposts. So here is the difference that Delta makes. The latest analysis out today confirms it is much more easy to catch than Alpha, 64% more transmissible, to use the jargon. It's also more severe, with double the risk of hospital admission if you catch it. Experts warn that is a problem even if those patients are unvaccinated younger people who quickly recover, because the NHS is straining to catch up with the backlog of non-COVID patients.
We have millions of people waiting for routine procedures, for routine medical care, and we cannot afford to have not just hospitals overwhelmed, but essentially any hospital capacity at this point in time being taken up by patients with COVID, because it does require a significant amount of capacity even to deal with a small number of patients with COVID because of the need for isolation, etc.
So fear of hospitals becoming overwhelmed, is that likely to happen?
Well, cases were always going to rise when we unlocked. That was expected. It was built into the model. But here is actually what is happening at the moment. This graph is plotted on a log scale, which turns exponential growth curves into straight lines, making it easier to see the changes in the rate the epidemic is doubling and doubling and doubling. And as you can see, from where we had reached, COVID cases in England are rising at an accelerating pace. And project that exponential growth forward to June the 21st, and we're looking at perhaps 17,000 new infections every day. Now, I bet you're thinking, this matters less because the link between cases and hospitals and admissions has been broken. Well, not completely. Let me show you the same graph for hospital admissions in England. Yes, the acceleration isn't so sharp, but it has clearly turned a corner. The good news here, though, is only 1 in 10 of those admissions is someone fully vaccinated, even though they used to be the most likely to be severely ill. So, buying time to get those second jabs in, to get those first jabs in, is becoming more and more important, and that's clearly what the government has been signalling today.
We've had some hard-fought battles against this virus, so let's not squander those hard-fought and won battles. Let's take things really carefully. We'll share the data with the nation, and of course we will, through that data, be able to, through the 4 tests that the Prime Minister set, be able to then, on Monday, say exactly where we will be for June and beyond.